Well, good evening, everyone. It is 7 p.m. now of April 10th of 2020. We are at the National Palace of Mexico here in Mexico City, and we will be starting now the daily conference regarding the COVID-19 epidemic situation. Today we're going to be talking about a special topic that is of great interest to all of us, and we want to be talking about it from now on because this is a health related situation that is very important to all countries around the world, Mexico included, and becomes even more important in situations in which social life and individual life are greatly affected. And this topic is mental health and addictions, which is a dimension of health that always require of a permanent and constant monitoring and attention, but is especially important within the context of a pandemic like the one we are currently experiencing. Today we have here Dr. Quijada, who is the leading psychiatrist in our country in the matter. We also have the doctor here, who is the leader of the Mental Health Committee. We have Dr. David Girov, who is the leader of the Center Against Addiction in Mexico. And we have Dr. Julio Rafael González Olvera, who is General Director at the same National Commission Against Addiction. And of course, Dr. Jose Luis Alomia, who is the General Director of Epidemiological Attention, is here like usually to present the technical report. Thank you, Deputy Secretary. Good evening, everyone. Let's begin with the international landscape. As we can see, we've been observing a decrease in the proportions of the burden of disease globally during the past few days. We've been coming down from a 78% that was the highest number we reached at a certain point, and now we are under the 70%. Of course, we're also presenting the fatality rates per country. On average, the fatality rate of the disease is 6.1% globally, even though there's great variation amongst different countries in the world. Here we have the burden of disease. This is a new chart that we are presenting today. And you can, this is the burden of disease represented by region. We can see how the Americas and the European region are looking similar, even though the European region still has the highest proportion of the active pandemic, but you can see how the Americas and the region of the Americas is becoming ever more represented in this chart, and will continue to be more present in the future. Here we can take a look at the national statistics. We have a total of over 3,000 new cases now confirmed, and we have almost 20,000 negative cases, 233 unfortunate deaths, and we have a total number of studied cases of 33,000 cases. As we can see, as usually, we have the graphic distribution of the burden of disease per state in Mexico City, and we can see that we are observing a similar behavior that the one that has been presenting itself during the last week. Here we can look at the incidence rate chart in which we can compare the total number of infected patients per state as compared to the incidence rate per state, which is taking into account the population of each state, meaning the number of infected patients per 100,000 inhabitants in each state. The national incidence rate is 3 cases per 100,000 inhabitants, but the variation per state goes from 11.53 to point 50 something, which is Chiapas state. And they're all represented in this chart. On this chart, we can take a look at the distribution per age group, and we can observe the kind of treatment that these people required when they went to seek for medical attention at our medical units. Now we have degrouped previously we had all of the senior citizens over 65 all grouped together in one group, but because of the recommendation of Engineer Duque, we now have degrouped that over 65 group, and now we have separated the population of senior citizens into several subgroups, which allows us to have a better look at the data overall. It is very important to notice that if you take a look at the different age groups, specifically starting at 65, the yellow bar is greater in magnitude than the green bar. And of course, in younger age groups, the green bar, which represents the outpatients, is greater than the yellow bar, which is the inpatients. This, of course, means that senior citizens, especially those older than 65 years old, are more likely to present severe symptoms and find themselves in the need of being hospitalized. And we'll see similar characteristics in the proportion per age group of the fatality rate that we will be examining in a bit. This is the state of patients when they first seeked medical attention. Most of them were outpatients. Some of them became hospitalized but are stable. 10.33% was the stable group. We had a slightly higher percentage that was the critical condition group, and then we had a smaller percentage of patients that had to be intubated. Following slide, we can take a look at the recovered patient information. All of these people are the people who got infected at some point, but they had a favorable recovery process, and it's been over 14 days now since they first got the disease, and now they are considered to be recovered patients. 6% of the total amount of patients, unfortunately, have lost their lives. And these 233 people who have unfortunately passed away, they all had some pre-existing conditions such as obesity, diabetes, hypertension, and to a minor extent, they were either smokers or presented kidney failure or any or the other conditions that are listed here. Here we can take a look at a new chart that we want to use to express the risk that exists of presenting complications and eventually dying because of this virus. Here we have the population divided by age group, up to 25 years old, 25 to 50-year-old, which is the economically active population, most of them working, being actively in the work space, and we also have an older group, the over 60-year-old group, who are at greater risk in the context of this pandemic. And of course, we are making a call to those senior citizens that belong to this group to be especially cautious of abiding by all the measures that we have recommended from the federal government. Now here we can take a look at the fatality rate for the people who had been infected and are over 60 years old. It's 13%. So it's quite higher than the fatality rate for younger age groups. The fatality rate is greater. So the message is this: if you belong to a vulnerable group who is at higher risk, either because you are over 60 or because you present any pre-existing conditions such as diabetes, obesity, hypertension, etc., then please be aware that you are at a higher risk in this pandemic, that you should be especially cautious of staying home and keeping your safe distance. Here we have the fatality rate per state, and the other one is the mortality rate per state. As we've said before, the mortality rate is directly related to the population of the state, and the fatality rate is directly related to the number of cases that had presented themselves within that state. And here we have the epidemiological curve, that of course we are still looking at an upward trend. We've seen a small decrease a couple of days ago, and now today we see a slight increase again, but it's all within the expected variation range. Thank you. That would be all for today. Yes, now our colleagues who are the specialists in mental health will have the floor now, and they all specialize in different fields related to mental health, and each of them have prepared specific topics to share with us. Thank you, Deputy Secretary. This is a unique time in our lives. The way we understand our interactions with other people, including family members, friends, neighbors, workmates, they are undergoing a change process, and they might never be the same, or at least won't be the same in the short future because of this situation. We are all together collaborating, all the the health sector overall professionals. We are all working together to help you all as a population. We wanna come out of this crisis more united, more with greater solidarity as a people, and we wanna go through all of this all together. Mental health is the state in which a person, it's the mental and social state in which a person is capable of putting their gifts and their abilities to use and face the daily challenges that life presents. These abilities of mental health related abilities will help us to move towards achieving our goals and confronting life's difficulties and interacting better with others. This is mental health. Some important elements of mental health are having regular schedules, getting enough sleep, having fixed eating schedules, exercising so we can strengthen our immune system, our physical health. This is the physical part, but how do we strengthen our mental health through the proper managing of our emotions, expressing our feelings, interacting with others, on a social scale, communicating respectfully, being tolerant, avoiding violence. These behaviors strengthen our social health, so to speak. Let's talk about fear. Fear is a natural feeling. A little bit of fear can be useful under certain circumstances. It could even help us be better people because it challenges us to overcome our fears. But sometimes fear can be excessive. And when fear is excessive in our life, we um we don't wanna allow that to happen. We wanna face fear because that will make us better people overall. We also have a message directed at teenagers and young people. We wanna recognize the effort of all of you staying at home right now because we know it is difficult for you to stay at home and not go out and hang out with your friends or maybe not be involved in your daily activities such as going to school or going to see your grandparents. But we want to recognize and we want to commend you on the effort of staying home. Please be confident in the fact that we will be getting over this crisis sooner than later. And please, all of you, especially adolescents, be calm, read a book, watch TV, exercise, and please contribute to the overall well-being within your homes and your families. These are the things we want for our children, our youngsters, and remind everyone that by staying home, by respecting each other within our home, we will create a better environment to overcome this together. If you, as younger people, feel anxious at times or doubtful, please do express your concerns, ask your parents, ask your relatives, and do not be afraid because we will overcome this together. Thank you. Now, doctor, you have the floor. Thank you. Yes, next slide, please. Good evening, everyone. Uh, yeah, we were talking about epidemiological crises and how they affect mental health, or they can potentially affect the population's overall mental health status. Because of this, part of the response to COVID-19 implemented by the Health Ministry involves a component that is directly related to psychosocial support, mental health, vigilance, and the prevention of addictions. These efforts require the hard work of a multidimensional specialized team that involves psychologists, medical practitioners, sociologists, all sorts of professionals that are implementing these actions. These actions are aimed to be implemented before, during, and after the duration of the pandemic. The target population is the general population, including the people who are infected by COVID-19, the people who take care of the infected patients, and all the health personnel in our country as well. We have 5 components that are essential to the mental health strategy. First of all is the primary attention through promotion of mental health measures. We also have pre-hospital attention um, through ambulances and phone assistant lines. That would be the third sector. We have hotlines for the prevention of suicide and for the handling of mental health related issues. we want to connect these phone lines and these hotlines to create a larger national level hotline network so we can be more efficient in our efforts. We are also implementing a screening process, a screening protocol for mental health, and we're designing a protocol for the intervention of mental health crises. And this attention can be implemented both in person and remotely because we're not always in the position of going in person to provide attention for the people who need it. Of course, we also have some overreaching actions or steps that are applied through each of these steps, and they include, of course, having a gender perspective. Let's talk about the psychological consequences that can come out of a situation like this. There are three phases that have been identified in a disaster. We have the first phase, which is the pre-disaster or pre-crisis phase. We have the impact phase, which is during the process of the disaster or the crisis. And then we have phase 3, which is after the crisis. These three phases have been described and studied in scientific literature, and it is through the study of these materials that we want to prepare ourselves to deal with the possible psychological reactions that could appear within the population. This is addressed through the implementation of different workshops, the making of videos that are informative to the population, and a distribution strategy that allows us to reach each of the citizens so they can know how to handle these situations should they come across one of them. And of course, this would not be possible without the collaboration of all mental health related institutions, but also thanks to the interinstitutional cooperation of many public institutions from different states. And this includes public institutions as well as civil society institutions and international institutions. We're all working together on this response. The health personnel and the first responders will are of course subjected to higher levels of stress, physical stress and psychological stress, and this can lead to several problems like burnout or physical impact, or it could also have an impact on their mental health. So it is important to have some guidelines present, especially when talking about first responders and health personnel. First of all, because we want to take care of us so we can take care of others. And we want to take care of our team, and our team includes us. So these measures are aimed at decreasing the stress levels, and we're also implementing training strategies regarding mental health, and we are also implementing screening protocols that are addressed to the general population but also to the health personnel specifically. We're also giving mental health support online and through phone assistance. So let's remind everyone that we're all together in this and we will all together pull through this. Thank you. Good evening, everyone. Thank you, all of you, citizens, journalists, people who are watching us from home. It is a great opportunity to be able to be standing here and talk on behalf of the mental health workers of our countries. Because to have this opportunity to interact directly with the population is very valuable to us. before we entered this pandemic, mental health in Mexico was already experiencing a great change in a great evolution towards a more democratic state of affairs. Nowadays, the right to mental health and the need to have proper institutions that guarantee mental health to our population is a very present need within our country and within our institutions. These are the groups that are most vulnerable in the context of the epidemic. These groups have usually higher risk factors than other groups and have an increased vulnerability during situations like this one. We have indigenous peoples or originary peoples, we have people over 60, we have substance consumers or abusers, we have people with disability, we have people that are sexually diverse, we have people who have some sort of mental or psychosocial disability, we have pregnant women, and we have people who have been deprived of their liberty, meaning inmates. Um, these are all vulnerable groups. When talking specifically about the substance consumers, this is not only about the people who have a pathological consumption of certain substances, that is approximately 19% of Mexican population. We are talking about all of substance users, Over 60% of the Mexican, over 70% of the Mexican population occasionally consumes some sort of substance, for example, alcohol. So we want to make a recommendation that for all people to abstain from alcohol during these times, or at least have a very responsible and moderate consumption. Talking about the inmate group, the people who have been deprived from their freedom, these are people who are in a recovery center, in a controlled environment, in order to let go of their addiction, for example. All right, so I'm talking right now to the substance consumers. First of all, if you do not consume, then do not consume. Keep doing what you're doing. Do not consume any substances. We are addressing new concepts in the context of this pandemic, for example, of pulmonary health. Our lungs are organs that we have to take care of, just as we take care of our eyes or our hands or our heart. So all of the people who are users of cannabis, or that do vaping, or that smoke, these are all behaviors that affect directly their pulmonary health. So we don't have more specific information relating to this specific pandemic, but judging from other pandemics that are also of respiratory infectious diseases, we are pretty sure that smokers and vapors and these people who consume these substances are increasing their risk in the face of this pandemic, because they are having an impact on their lungs, on their pulmonary health. So I think we should consider these practices as harmful to our health and dangerous in the context of a situation like the one we are currently experiencing. Now, this one is also very important, the illegal substance consumers. I don't want to trivialize a situation such as difficult as having an addiction, but people, citizens that have some sort of addiction to illegal substances, this is the time to stay at home. And we know there might be a physical need, uh, a physical dependency to these drugs. So you can take advantage of the quarantine. Try to see this as an opportunity if you have an addiction or a dependency on some substance. Try to see this quarantine period as an opportunity to stay home and get rid of your addiction. It is also very important to take into account that, especially when talking about the illegal substances, because of them being illegal, it is very difficult to regulate their quality and purity standards. So be aware of what you're using, because you might not be using very pure substances and they could add an additional risk to your health. And finally, alcohol consumers. We know that when the alcohol consumption levels go up, domestic violence goes up. We've seen this repeatedly over time. And just as Dr. Quijada was saying, right now we have to be we gotta be tipping on our toes. We have to be very careful of anything that might increase our risk during this pandemic. So alcohol, because it affects the central nervous system, it could impair our ability of response in the face of an emergency situation, for example. So please be aware of that. Now, talking about our health personnel, this is a tricky situation because this personnel is both in a vulnerable situation at a higher risk, but is also a very valuable and very precious personnel in the face of this pandemic. And that leads to them needing special care. So this is like when you're on a plane and the flight attendants say to you that if the cabin starts losing pressure for some reason, before putting the oxygen mask on your children, you need to put it on yourself so you can help your children. So this is the same. We need to put that oxygen mask on our health personnel first so they can help us. And some people have been talking about the increasing in the restrictions and the prohibitions as the pandemic moves forward, but let's remind everyone that this is a situation in which we have to show great solidarity and great joint work. Now, we have 5 important premises when it comes to having a proper response in the face of these situations. One of the biggest elements that is affecting us right now is uncertainty. So we have to be aware that we need to move as we see and as we go. We are adapting our daily responses, taking into account the development of the pandemic, taking into account international responses, international recommendations. So we need to be very aware of this situation. Second, we are vulnerable as humans, as people. We live in a permanent need of others' solidarity. Who are the people who are working right now as health professionals dealing with this pandemic? These are Mexicans, men and women who have been who had been trained by the best universities our country has to offer, and they are people just like us who are responsible, who are empathic, and who are giving their very best in order to provide a better care for all of us. Now, number 3, it is very important to be able to act in a uniform manner, to follow instructions and to cooperate with our leaders and with the team leaders. Of course, we encourage everyone to be creative and have some proactivity and have their own initiative when it comes to contributing to this situation as well. Now, finally, the fifth point, the mitigation measures must be applied thinking of at least a mid-term time frame. And I think this is something we've been successful at because we've been preparing and implementing strategies that are aimed to at preventing what will happen several weeks from now. So, talking about work organization, I think we are very fortunate to have people like Dr. Hugo Lopez Gatel and Dr. Alcocer leading the common strategy against COVID because they are very professional and very responsible people, and I think under their leaderships we will be able to succeed in our effort. It is important for us to be supervising closely the work within medical units, within clinics, and also the human interactions that are happening within these human clinics, because all of us need to talk, including the medical practitioners and the medical professionals. They need to talk about what they're experiencing. They need to talk about their feelings. They're under a lot of stress, and it is important to also have a humane response to their concern. It is very important to learn how to communicate from afar. This is an absolute necessity. We are nowadays we are being very creative in our when it comes to our hairdo and our pajamas because we are all working from home. So you can imagine. Um, but this is important to keep being creative. Well, finally, I thank you very much for this opportunity, and now I would like to give the floor to Mr. Dr. Olvera, and he will talk about the prevention of addiction. Thank you. Thank you very much to all of my colleagues, Deputy Secretary Dr. Gattel, all the team that is in charge of the mental health strategy. On this next slide, I would like to talk about, and specifically, I would like to address all the population and all those users and all of those people who maybe have a friend, a relative, a work colleague who has started to drink more often, for example, or they're eating more than usual, or maybe they're stressed or they're feeling anxious because they cannot see their grandparents, their uncles. Maybe some of them are afraid of going out. What is happening with all of these citizens, compatriots, friends? What can we do? Because we also have the case of people who have gone into depression or living in fear, not to talk about the ones that exhibit obsessive thoughts, compulsive behaviors, and that in the face of all of these recommendations of staying away from germs, washing our hands, they see these anxiety levels elevate. So, what is happening to all of us, ourselves, that can affect the way we interact with others? For example, when we go to the supermarket to grab some vegetables, some fruit, or some medicine, who do we ask? Well, we have a national health system currently, a national information system that as you can see, every day is updating information and presenting clear, updated, reliable data to all of us. But what happens to all of these people who are having a bad time? Who can they call? And what I want to show you on this map is the service network that exists and is in charge of the Ministry of Health for the attention of mental health related issues and substance abuse related issues. We have psychiatric hospitals all over the country. We have mental health centers. We have 338 primary centers for the attention of addiction, and they all have specialized personnel that is able to provide orientation and care for all of these people who might need it. We also have 117 youth integration centers. All of these centers, as I said, are operated by highly specialized, highly trained professionals who are constantly being updated and optimized in their training. On top of this, we have some service areas like prevention area or the intervention area, attention area. All of them offer workshops, conferences, and because now we cannot have live presentations, they're providing phone assistance, they're doing workshops and conferences online. We're providing attention for substance consumers, but not only to the consumers, but also to the relatives or to anyone who has been experiencing some addictive behavior. We also have crisis intervention in the face of different kinds of emergencies. We have a network of subject-based assistance hotlines. We have provide assistance in the topics of violence, sexual health. We are monitoring, and all of these services that we provide, we are also evaluating the way in which they are being provided to the citizens. So who are the people who can have access to these services? Well, let's remember all people who have, or all of us who will be experiencing at some point in our lives some sort of mental health related issue, even if it's just a stress response to a changing situation and to the uncertainty that we are experiencing, and including those people who consume substances, all of us, all of them, all of us together, all have a right to health. Yes, because let's remember there is a sort of a very prevalent stigma surrounding substance consumers and people with mental health issues, and this can lead into a spiral of shame and fear. So let's remember we all have a right to health and to mental health. We all can experience fear of being infected or being judged, or we can hide in alcohol or in drugs or in smoking to deal with this fear. So this is completely normal and natural, and to know these things is important in the recognition of such stigma. It is time for us to be able to talk openly about these topics and seek for attention. So remember, the way in which or one of the ways in which we can greatly improve our mental and physical health is one that doesn't require hospitals. We can do it through exercising every day, through talking with our friends, with our relatives, to expressing our emotions. So we do encourage you to do it. On social media, we are launching a very important information campaign to strengthen the access of the population to these services in the face of this pandemic. Please remember one more thing. When we are in isolation, when we are under stress, a big problem that we see is auto or self medication to deal with pain, for example. We know there's been a great problem uh, all over the world with pain medication because it can be very addictive. So, and a lot of people in different countries have started self medicating, especially for opioids. So, please avoid self medicating. Call our attention lines. Seek for medical consultation or mental health orientation. We have these lines, these hotlines that you can call. These numbers belong to a network that has been articulated by different attention and information systems that include several services. We have the UNAM hotline, we have the Life hotline, we have Locatel, we have the Juvenile Integration Centers, and of course we have the unit for epidemiological and health intelligence. You can also find a lot of information at our official website, especially regarding alcohol consumption and substance consumption. Please help us spread this information, and thank you very much. Thank you, Dr. Jorge González Olvera. We do believe this is a great opportunity to strengthen ourselves, to grow, to get to know each other, to see ever greater families in their solidarity and in their mutual affection. That would be it. Thank you, Deputy Secretary. Thank you, Dr. Rodriguez Bores, Dr. Jorge Julio González Olvera. Thank you. I changed your name before. Sorry for that. Let's begin the Q&A period. Let's see if we can deal with 2 or 3 questions. Thank you. Dr. Quijada, I want to ask you, do you have a concrete statistic or do you have specific information regarding the increase in mental health conditions, for example, depression or anxiety? Because we know other data, for example, domestic violence has increased indeed. So, what can you talk about this? And second question, this new graphic, this new chart that you presented, that has the age group, this means that we have more people in Mexico that are being infected, even though they're relatively younger. So if I got it right, does this mean that most of the people who die are over 60, right? Are senior citizens? Did I get that right? Yes. Regarding the data you asked about, we have very specific information that comes from the Life hotline. We have seen an increase in calls seeking for mental health related attention. And in talking about specific cases of mental health crisis, we've seen a decrease actually because of the implementation of the isolation and social distancing measures, but we are prepared to deal with an increase should we see it during the following weeks. The calls have increased by a factor of, doctor, do you have the specific number? Well, I can tell you we are having hundreds of calls per hour. It's not only calls. We have all sorts of interaction with the population. And there is an age gap in this situation because people under 25 usually seek attention through social media and online. And people over 25 usually call the hotline. But do want to emphasize that we have created this phone assistance network that is working in a very efficient way, and it's very extended in their reaching capacities. Last week we had almost 2,900 calls. The reasons for the calls were related to stress, anxiety, depression, and workplace conflicts. So we have seen an increase in the amount of calls seeking for mental health orientation in the past week. And as to your second question, yes, precisely what the fatality rate is indicating is that the people who are over 60 years old are dying 2.7 times more than people who are under 60. Especially if we compare with people under 25, this age group has not had any fatalities whatsoever. So, yes, senior citizens, please stay home. Thank you. Good evening. Today you're asking the population to moderate their consumption of alcohol. And today we knew that the beer companies restarted the production of beer. So what would be the message here? The the Secretary of Agriculture reactivated the production of big beer companies, but the Ministry of Health is telling us to reduce our alcohol consumption. So what is the message here? And talking about the origins of the pandemic, we've heard that the origins was maybe a bat or some sort of animals, but the actual reason for the origins of the pandemic was the illegal traffic of protected species. So what is Mexico doing on this front? I know this is not the main issue right now. The main issue is the pandemic, but what is the Mexican government doing to strengthen the institutions that prevent the illegal traffic of species? Well, first, your first question, this is a mistake that will be corrected. There is a general disposition by the health authority that has established very clearly that all non-essential economic activities must stop. And this is very clearly stated in the law and according to our regulation which activities are essential and which activities are non-essential. And the manufacturing and distribution of beer is not one of the essential activities. So this was a mistake and it will be corrected briefly. So this was a mistake. The beer industry is not authorized to restart production. It's a mistake. Whatever you heard, it's a mistake that happened and it will be corrected. And talking about the protected species, if indeed the virus, the new virus that the emergent virus or the new kinds or strains of virus that lead to respiratory infectious diseases or just infectious diseases in humans, 3/4 come from the animal from animal life that is non-human life. In part, this is related to the traffic of illegal species, but also to the expansion of human activities and human communities to natural territory and the degradation of the environment. So by displacing, when a community expands, they invade and they disrupt the natural equilibrium that exists between animals in that region, and this creates all sorts of phenomena. This is a worldwide phenomena. So even though we've talked about the pangolin as being the origin or the species that transported the COVID-19, the coronavirus SARS-CoV-2, we still have don't have conclusive evidence that indicates so. Um, so is Mexico gonna be closing wet markets in which live animals are sold? Well, this is a topic that is outside or is not directly related to the Ministry of Health. The secretary, the Ministry of Environment is led by one of the most prestigious Mexican scientists, Dr. Victor Manuel Toledo, and he has a very wide prestige, and he is a very responsible and professional person with a great social responsibility and personal conviction. It is a privilege to have him lead the Ministry of Environment, and maybe we can invite him to come here sometime and talk about this more specifically. Thank you. Thank you. Good evening. That last question. Very interesting, all of these things that you have been saying. How can we present this information to the people who have autism, because it is more difficult for the population with autism to abide by these measures. Also, what can we do about the people who are deprived from their liberty? And finally, today we went to La Villa Market because of the Holy Week, and we saw there was a lot of people. So yes, talking about the people with autism, not only the people who have autism, but we also have people who are experiencing other conditions triggered by this situation, who have schizophrenia, who have depression, who have anxiety, and all of them are being provided treatment. Specifically talking about the autistic patients or the persons with autism, their parents and their relatives have been trained and have been oriented to in regarding the special measures to take care of them at home, and we are open to provide phone assistance should they find any difficulties or these people at some sort of crisis, for example. Yes, that's it. It's almost 8, so we'll continue tomorrow. Thank you.